Yeah, good morning. ALK positive NSCLCs are well known for its propensity for CNS metastasis. Even 30 to 40% of ALK positive NSCLCs can have brain metastasis upfront. And some of these second generation ALK inhibitors, though they have a very good CNS penetration, durable and sustained CNS activity, still these patients fail in the brain. When they fail, we don't know what is the mechanism operating, whether it is the resistant mutation developing or whether there is the problem with the pharmacokinetics, because these lesions may not be biopsiable, and very often we cannot offer surgery as well. So in this context, I am presenting this small study. This is a phase 2 study of Lorlatinib in patients with Anaplastic Lymphoma Kinase, positive lung cancer and CNS specific relapse. The key objective was a subset of patients with ALK rearranged lung cancer will experience CNS only progression on second generation Anaplastic Lymphoma Kinase inhibitor. The efficacy of the third generation ALK inhibitor, Lorlatinib, in this context is not well defined. So this is the study, and the key eligibility was ALK positive NSCLCs with a measurable intracranial disease as per the modified RECIST criteria, or radiographic evidence of leptomeningeal disease, and the no measurable and active extracranial lesions with more than one prior ALK inhibitors. And there were 23 patients, and the dose of Lorlatinib was 100 milligram and given for 21-day cycle. And those who have shown response, like the objective response is defined, the intracranial objective response was defined as stable disease, partial or a complete response, and those who have shown a response will be allowed to continue Lorlatinib, and those who have developed a toxicity or a progression were discontinued on this. And the primary endpoint was the objective response as defined by the stable disease, or a complete response or a partial response. If you look at the prior lines of therapy, majority of them had 3 lines of therapy, and more than 90% of them had second generation TKIs, ALK TKIs. And if you look at the safety profile, these patients, the adverse events were similar to the other studies, like the elevated cholesterol, triglyceride elevation, and peripheral edema, cognitive effects, and mood effects were the common side effects. And coming to the response, about 59% of these patients had objective response, which includes about 14% of complete response, and another 36% of the patients had stable disease, indicating that almost 95% of durable clinical response. And if you look at the intracranial progression-free survival at 12 months, you can see that the median PFS was about 24.6 months, and only one patient on continued follow-up developed a progression of the disease intracranially, and vast majority of these patients had dose reductions as well. So this median PFS of 24.6 months is a very remarkable achievement, and the authors have even put a picture of a complete resolution of a brain metastasis after 6 weeks of Lorlatinib. So in summarizing, in this phase 2 study, it is though a small study, it is observed that there is a robust intracranial activity of Lorlatinib in patients with isolated CNS progression on second generation ALK TKIs. The intracranial DCR of 95% with Lorlatinib in this context suggests that brain metastases from patients with the CNS only progression remain ALK dependent. Though this is from a different study, the similar results were seen with a continued response. So what is the relevance of this study? This prospective clinical trial suggests that Lorlatinib has robust intracranial activity in patients with the CNS only progression on second generation ALK inhibitors. Given the challenges of characterizing molecular mechanisms underlying CNS specific progression events, this study supports empiric use of Lorlatinib for patients experiencing this unique pattern of progression. Thank you.